Hello, Placer County. This is your health officer, Dr. Aimee Sisson, here to answer some questions I'm being asked about the current state of coronavirus in Placer County and whether staying at home is still necessary. The first question is, Placer County doesn't seem to have very many cases of COVID-19. Is the situation really as bad as we feared? Let's start by going over some numbers. Placer County has 127 laboratory confirmed cases of COVID-19 to date. Around 2,500 residents have tested negative for coronavirus. Approximately 400,000 people live in Placer County. So these 2,624 tests mean we've only tested less than 1% of the population. The availability and speed of testing for COVID-19 is improving, but it's still really low. There aren't enough swabs to collect samples from patients or testing materials for labs. We aren't able to test everybody with symptoms, let alone people without symptoms who could also be infected. Since up to half of people infected with coronavirus may never get sick, if we only test sick people, we are missing up to half of cases. My office gets contacted regularly by Placer County residents who have symptoms of COVID-19 but haven't been tested because their symptoms are mild. Many, if not most of these people would test positive if we were able to test them. But since we can't test them, our numbers stay much lower than they actually are. If we can't rely on laboratory confirmed cases to tell us how much coronavirus is actually out there, what can we use? The number of people in Placer County hospitals with coronavirus is one option, and we're sharing this information on our website. The good thing about hospitalization data is that it's unlikely to miss cases. People who are sick enough to go to the hospital are going to do just that. This means we can track hospitalizations over time to see how Placer County is doing. One downside of hospital data is that Placer County hospitals don't just treat residents of Placer County. Many people from Sacramento County, for example, come to Roseville hospitals. Likewise, many Placer County residents go to hospitals in Sacramento County. So we can't compare case counts and hospitalizations directly. There are 18 patients confirmed to have COVID-19 in Placer's 3 hospitals. Some of you may be thinking, only 18 hospitalized patients with coronavirus in Placer? Does this mean we shouldn't be worried about our hospitals being overwhelmed? It's a fair question. First of all, I would like to caution against thinking we are out of the woods. Models, which I'm going to say more about in a minute, aren't projecting California's peak hospitalizations until later in May. The relatively low number of cases of COVID-19 patients in hospitals right now indicates that our stay-at-home measures are working. Take a look at this data, which shows hospitalizations of confirmed COVID-19 patients in Placer's 3 hospitals over the last several weeks. What you can see is that hospitalizations are staying relatively stable and are not rising rapidly. It is great news that stay-at-home orders are working and that we are flattening the curve. Thank you all for doing your part to stay home and stay safe. We have saved lives by staying home. But the curve will not stay flat if we end the stay-at-home orders too quickly. The last thing we want to do is undo all of everybody's hard work by lifting the orders when there's still a lot of virus activity in the community and end up having a big bump in cases, hospitalizations, and deaths. If we keep going strong on our physical distancing efforts, current statewide models are projecting that the peak number of hospitalizations may in fact be within the capacity of our now expanded healthcare system. By canceling elective surgeries, hospitals have freed up a large number of beds for COVID-19 patients. And they still have many other aspects of their surge plans that they can implement. Placer hospitals are rising to the challenge and anticipate being able to double their capacity in response to COVID-19 if needed. With doubled local hospital capacity and the availability of Sleep Train Arena as a field hospital resource for the greater Sacramento region, and the success to date of stay-at-home orders, we now think it is highly unlikely that we will need to open up a field hospital at a Placer County fairgrounds site. Let's look at those statewide models for a minute. In early April, California Health and Human Services Secretary Dr. Mark Ghaly shared a model of what hospitalizations would have looked like if no stay-at-home orders were issued. This model showed a very large number of people needing hospitalization in California due to COVID-19, but nowhere near enough beds being available for them. The results of this model helped to prompt the governor's stay-at-home order. The first model also showed that even with the stay-at-home order, California would need more hospital beds than the number it already had or could quickly create in order to be able to take care of everybody who was expected to need care for COVID-19. It was this "we need more beds" model that encouraged us to move forward with planning for a local fairgrounds care site. Last Friday, April 10th, Dr. Galley provided results of an updated COVID-19 model for California. This model showed that staying at home is working, and working so well that we may not need all of the extra hospital beds that we've been preparing for. This is indicated by the light blue with intervention line on the chart. Of course, this will only hold true if we continue to stay home, and as the slide shows, there is a wide margin of error, so we can't say with any real certainty what will happen. I would say that I am cautiously optimistic. Many of you are tired of staying at home and are wondering, when will we be able to loosen the restrictions and allow people to be more mobile? Public health officials and other experts are putting a lot of thought into the criteria for loosening physical distancing strategies. As I mentioned, loosening up needs to be done thoughtfully so that we don't get another wave of cases that results in more disease spread and death. Much of infectious disease control is based on incubation periods, which is the time it takes after someone is exposed until they get sick, or until they are infectious in the case of someone who never develops symptoms. The incubation period of this coronavirus is up to 14 days long. This is why we ask people to quarantine for 14 days after they've been exposed. If the number of new cases or new hospitalizations decreases for 14 days, that is, one incubation period, it would indicate that disease activity in the community is slowing down and that loosening up of restrictions could be considered. Many experts also think that we shouldn't loosen stay-at-home orders until we are able to test everybody with symptoms. Without the ability to test people who become ill, we won't know if coronavirus activity is ramping up again, and we could end up with a wave of cases that we don't see coming until it's too late. We need to be able to closely monitor the community for disease, to test, identify, and isolate people who are sick, and quarantine their close contacts. Testing capacity is increasing, but it is still inadequate. We need more swabs and more testing supplies, and we need these soon. Unfortunately, this is not something that we can control at the county level. The testing limitations are much bigger than Placer County and need to be solved at the national and statewide level. When we do relax or lift stay-at-home orders, we will not be returning to life as usual pre-coronavirus right away. We will still need to take individual and collective action to prevent coronavirus transmission. We will still need to wash our hands regularly. We will still need to avoid large gatherings. We will likely still need to wear face coverings when going out in public. Many of you have written me wondering why it was necessary to strengthen the stay-at-home requirement last Friday when we were already succeeding in flattening the curve. While we did use the term strengthen in describing the order, the guidance was strengthened because it went from being a directive to an order, consistent with the statewide stay-at-home order. We didn't strengthen the actual restrictions so much as clarify them. The list of essential businesses is actually longer than before, meaning more business types are allowed to operate under this new order than under the earlier directive. Recreational activities were a major area where my new order clarified the guidance in the original directive. The intent of the first directive was to allow only walking, running, and biking in our neighborhoods, and all communications from my office subsequently indicated that golf courses and playgrounds should close. However, because this was not being uniformly followed, the new order explicitly stated that these entities should close in order to eliminate confusion and protect the maximum number of people from COVID-19. Our goal remains to protect the people of Placer County and save lives. Many are feeling the economic impact of the measures taken to control COVID-19, and I can understand that our relatively low number of local cases and deaths might not seem to justify the measures. Please keep in mind that California and Placer's cases and deaths are relatively low because of the early and decisive measures we have taken. Had we not acted, our hospitals could have been hit as hard as New York's or Italy's, and they still could be if we do not stay the course. I am proud of the way our residents have responded to this crisis. We all want the coronavirus crisis to end, but for the time being, we need to continue to act responsibly as a community to protect one another. That remains our best way through this. Thank you for continuing to stay home and save lives.